Some of my patients present to me as an infertility specialist with secondary infertility or subfertility, we call them, because they have few pregnancy loss before. So if you have by definition 2 pregnancy losses before, we call you or stamp you as a recurrent pregnancy loss. Now, this is a very depressing condition. I will say not painful, but depressing condition, because once you have a joy of pregnancy and after that you lose the baby, and it's a kind of a bereavement for you. So definitely there are plenty of reasons for it. So if you present to your doctor, we can do some investigations, some lifestyle management, some genetic analysis, and some of the cases we have some treatment, because if you have some problem like diabetes, that can also, if it is uncontrolled diabetes, thyroid, these are the problem can cause recurrent pregnancy loss, so it is easily treatable. Sometimes a problem called APLA or antiphospholipid syndrome, that is also another treatable cause of recurrent pregnancy loss. But sometimes some genetic cause, some other cause, unexplained cause are there. So those are not always treatable, but to know it is unexplained, you have to do few investigations. So if you have a pregnancy loss, please present to your gynecologist so that we can do few tests and try to explore the reason of the loss, and then accordingly we can treat you. But as a general advice, I will say maintain your healthy lifestyle. Because it is a cellular material, basically egg and sperm cell, they fuse and make a new pregnancy or new baby's body or zygote. So the aberration can happen, genetic aberration can happen in, it's very common to have genetic aberration basically. And human fertility is that only 20 or to 30% of the embryo we can make that will implant and make successful pregnancy and deliver. Rest of the embryos, even if it is formed, it is going to come out with your menstruation, or it is not going to implant, or even if it implant, it miscarry. So there are, if it is a genetic reason, yes, there is genetic reason, and Mother Nature is the best judge. When there is genetic abnormality, Mother Nature will not allow the pregnancy to survive. So these cases, genetic modification we cannot do. But if you are a healthy person, if you do not have any addiction, if your body weight or BMI is normal, you do not have any disease, or even if you have disease like diabetes, blood pressure, thyroid, you control it nicely and maintain a good healthy lifestyle with some exercise and eating healthy nutritious diet, then at least you have all the good thing to make your gene normal. Because most of the times we see the parental karyotype or the gene is usually normal. Very rarely some of us carrying abnormal gene, or we call them as it's a gene abnormality, means some are abnormal gene that causes recessive, very rare recessive disorders, which is also very rare. And most of the time genetic abnormality is acquired genetic abnormality. So if we can we can make our lifestyle good, our genetic material will be good, and chance of this aberration happening, which is otherwise common, will be less, and then you have a successful pregnancy. But like APLA, you need to have some treatment, some medications like aspirin and heparin that your doctor is going to prescribe. It is not for all, but for some patients, yes, you need to take it throughout your pregnancy to have a successful outcome, and repeated monitoring of the pregnancy. So basically, take some folic acid vitamin supplement before you fell pregnant, make a healthy lifestyle, and then fell pregnant. And the pregnancy usually, if you are extremes of age, like especially my patients are towards the higher age, means more than 35 years, then there is chance of miscarriage also increases, because the aberration of genetic material increases with age. So you need to, it is your choice when you want pregnancy. Of course, you need to balance between your career and your time of pregnancy, but always keep in mind that our reproductions, for female reproduction, it is age related, because we have a menopause or end of our reproductive life. So when we are approaching towards our end of reproductive life, then genetic aberration increases, and that's how nature works. So make your life is a balance between your career, your pregnancy, and if the lifestyle is good, and avoid any addiction, so you can help yourself to prevent this recurrent loss.